But then it's why we've got people like yourself coming on and talking about your role as a sports dentist, because it's very different from my role as what I do with sports dentistry, and it's very different to what John does as well. So
He's ruining all his athletes with cheap aligners, cheap aligner treatments. He's ruining all his athletes.
They might be injured, but they've got a great smile.
It gives me great pleasure to welcome to the Sports Dentistry podcast, Eider Unamuno.
Thank you, Jan.
Perfection.
The difficult surname for you.
Okay. Everything's difficult for me, So we've had the great pleasure of getting to know you well. I think the first time I met you was in Edinburgh in Murrayfield at the EF4SD conference that we had there a few years ago. But for anybody that hasn't come across yourself, can you give us a little bit of a background to yourself? How did you get into dentistry and how that went down the path of sports dentistry?
Okay, my name is Eider Unamuno. I'm from the Basque Country in the north of Spain. Nowadays, I'm the president of the Spanish Association of Sport Dentistry. And I got in dentistry like by chance, by elimination, because nobody in my family is dentist. My father was a plumber, my mother housekeeper, my brother engineer. But I liked the health care careers. Medicine was like too long, nursing too short. And I love seeing people smiling, so I thought that maybe it was dentistry. It was a good idea. And that's the reason I studied dentistry.
Now, where did you, so you're from Bilbao, are you? Is that where you're originally from?
I'm from Spain, the north part of Spain, Basque Country. Bilbao, San Sebastian are the most known cities.
And did you study dentistry
in Bilbao?
There? In Bilbao.
Yes, in the public university of the Basque Country.
And then now your clinic's in Bilbao? So did you always work there or did you travel?
Yeah, my office is like in the middle between the three capitals, between Bilbao, San Sebastian and Vitoria. Vitoria maybe is known because of the basketball Taurés Baskonia. No?
It's all I know is the running of the bulls, because I went to the running of the bulls when I was younger, and I tried to outrun the bulls. So that's my knowledge of the Basque Country.
Okay, it's a good point. That's Pamplona, Iruña.
Pamplona, yeah.
San Fermin, the 7th of July is the festivity of San Fermin.
Yes.
Yeah.
It's great fun.
Hemingway loves that festival.
Yeah, it's fantastic. And then how did you get into sports dentistry? At what stage, when you were being a dentist, did you start linking them together?
I think that I'm a really curious person. I studied orthodontist and TMJ pain, facial pain. And I was like thinking why some of my patients started with pain once I start with braces, or why some treatments finish well, properly, and other ones recollapse. I didn't get it. And I go deeper. I wanted to go deeper, and I knew the RNO. It's called in Spanish because it was something. It's like a philosophy that Pedro Planas describes. Do you know Pedro Planas?
I've heard the name.
Yeah. It was a really known dentist in Spain, 100 of years ago, more or less. He was born 100 years ago, and he studied which was the reason why of some adults get to this elder age without pain, without periodontal diseases. That's he discovered that behind all these cases was a real hard chewing function, an alternative function. Yes.
So,
He did.
yeah, so they had the ability to chew hard.
Yes.
That ability to chew hard then
Chew
was
hard.
also chew hard things was correlated with being able to get to older age without pain and problems.
Yes.
Okay.
Yes. It was correlated with, on the one hand, with proper growth, and on the other hand, without no gum disease and no disorders of TMJ. And when I learned that, it was like, oh my God, it makes sense. Odontology makes sense. And why some cases remain stable, because they are changing their chewing side.
Okay.
Sorry for my horrible English, but I'm trying to do my best.
No, you make total sense. And the reason I've heard that name is because a couple of my good friends are consultant orthodontists, and they talk about how you're seeing a lot of adolescents and a lot of adults with very narrow arches because we're not chewing our food as much anymore. Everything is very quick to eat, and nothing is really being bought in the stores where you have to actually physically break things down and take your time to eat. Everything is so fast now. You go buy something, you eat it very quickly, and it's causing a lot of this collapsed arch. So one of my friends did mention the name, and it didn't really kind of come together until you've just explained it there.
Yes.
So do you only do orthodontics, or is that just something that you do alongside sports dentistry, or is that what your initial love came from? Was it from this side of things?
Yes, I don't do general dentistry, but it's like a mix with, I work with orthopedics, orthodontics, airway issues, these kind of things, TMJ disorder pains. These kind of things are the things that I love to work in. Yes. Functional things.
I have a question. Was the ability to be able to chew hard things because their occlusion and things were in a good place, or was it the fact that they were chewing hard things allowed that to be in a good place? Does that make sense? Was it because their occlusion and everything from a neuromuscular point of view, was it in a good place, so therefore they were able to chew hard things on either sides? Or was it because they were chewing hard things first? Did that allow things to be in a good place? Does that make sense? What came first, the chicken or the egg?
I think that both Pedro Planas in Spain, but also another dentists all around the world, like Weston Price in Canada, John Mew in England, they talk about the same thing, that genetic is not the GPS of the growing, that the breath first, when we got born, and breastfeeding, eat hard things, the tongue position, breathing, all of these kind of things are that they are going to do you growth properly or not.
But then it's why we've got people like yourself coming on and talking about your role as a sports dentist, because it's very different from my role as what I do with sports dentistry, and it's very different to what John does as well. So
he's ruining all his athletes with cheap aligners, cheap aligner treatments. He's ruining all his athletes.
They might be injured, but they've got a great smile.
And in my personal history, I learned for the first place the chewing issue, but after that, breathing, airway, sleeping, all of these things are linked to Something is that you have in your genetics, but if you want to see all the things that your genes are covering, you need to offer a lot of work, hard work to your mouth.
Interesting. And then how did you get into sports dentistry? So you were doing this orthodontics, facial pain. You were wondering why there was differences between different patients. And then how did you link sports in?
Yeah. Usually I work with a lot of physiotherapists because they feel the difference between a usual orthodontic with braces or alignment or this kind of functional orthodontist. They feel the difference in their patients. So they send me a lot of patients. One of them, some of them were sport people. And when I used these techniques with them, they told me that, you know, that now I'm recovering better, or I am not suffering for my neck no more, or my pain in my back is not so hard. And I start linking this function of the mouth with the whole body, with sports people. And I go on studying in posturology, osteopathy, physiology, nutrition, and all the kind of things that I thought that it was a link. And that's the way that I fall in love with sports dentistry.
Yeah, that's interesting.
So what sort of treatment were you doing after the physiotherapist would send you the athletes and they were complaining of pain and discomfort? What sort of treatment were you providing them that would make them feel better?
Which one is the treatment? It depends. It depends. But in the really beginning, it was a occlusion treatment. It's like scarring. I don't know if it's the proper thing the technique thing, but it's something that sends the occlusion to a unique point, and then both sides needs to be like in an equal difficulty, this kind of things, but occlusal things.
Yeah, so we call that equilibration is when you're adjusting.
Yes, balancing the sides to chew properly, and the muscles feels the difference.
Yeah, no, I get that.
And so you were doing the treatments that you would offer, would that be adjusting the shape of the teeth so they could chew better? Was it providing splints, or was it orthodontally moving the teeth, or did you provide all them types of treatment just depending on the case?
Yeah, it's like everything. It depends of the case. I usually work with a lot of children. I love treating children because the grade of improvement, it's huge. They are growing. So you can, with little things, with little exercises or advices, you can choose the direction of the growth. You can model the growth in the lips, the tongue, all of these things that we already know that it impacts, or it takes a lot of things to do in a sport dentistry, and they are the future sports people, children.
Yeah,
I do like a mix between orthopedics and functional dentistry with this kind of balance, occlusion balancing. I don't know how to explain more better.
No, that makes sense. So that definitely makes sense. So what sort of things are you seeing in your athletes, certainly younger athletes now? What are the most common misalignments or malocclusions are you seeing?
A lot of crossbites, a lot of narrow maxillary arches, because the truth is that now I'm really focused on airway issues. And you know that when you are focused on something, you see only this thing. And the people who is coming to my office, they they usually come also demanding this kind of growth of adenoids. I don't know, this kind of children who is about being surgery treat.
Yeah, like
Yes.
post-surgery. And I have an interest as well in airway orthodontics. I've dabbled. I wouldn't say I'm an orthodontist, but I've dabbled and done some treatments. From a growing patient, there's a little bit of a debate on when you should start treatment when it comes to the development of the maxilla. What's your thoughts on that? When would you advise on trying to identify the need for treatment and then to actually start the treatment?
I think that it depends. With adults, it depends if they are or not sport people or professional. Because if a football player or if I don't mind, but if they come asking for aesthetics or alignment treatments, I usually say no. Or I'm going to do some tests to see if their mouth is giving bad information, very balanced information to their. My office is not focused on aesthetic treatments, is that focus on sport dentistry, but the type of sport people who comes usually is because of they have some pain, some kind of pain in TMJ or neck or back, and they are going and going to different physiotherapists and nobody can help them. And finally, go to Eider. Go with Eider and let's see if she knows. And sometimes the key is changing the occlusion and you need some kind of orthodontics work, but sometimes it's not. Or sometimes they ask for orthodontic treatment because the malocclusion is real, but it's not a feeling, it's a testing thing that you know that this patient, this sport person is not able to do inflammation week after week with aligners.
Yeah.
It's not prepared. It's not able to hold these changes in the occlusion.
Yeah,
It doesn't work sometimes.
That's what I was going to ask next was if you had an athlete and you felt the need for orthodontics to improve their occlusion, is there a consideration that as during the treatment, as everything is changing and maybe not the most stable, does that need to be taken in consideration? Like sometimes, like when we talk about maybe placing an implant in an athlete that has lost it because they take part in contact sports, that we're looking to try to place it in their off season when they're not going to be training or competing, so they won't take so there's no risk then of them taking maybe contact when the implant is healing. Is that similar to orthodontics when you're trying to plan with these athletes and you're like, well, there's going to be a period during this treatment where things are maybe not ideal and stable and they may have an impact?
The thing is that the orthodontic treatments are long treatments and you cannot do them in a pre-season because it's too short, the pre-season for them. Sometimes I chose when you finish your professional season, come and I will do the alignment or the things you need. But it's a test. It's a postural test that I do to my patients to know if they need that change or they don't. And if the answer is not an answer, but if the test says, yes, the malocclusion is too big to take, I will change. And I will change it in the way that the imbalance is fewer. For me, and I do aligners, but aligners in sports people is bad. It's like the worst.
Oh, don't tell me anymore.
Yeah. Why would you say that though? Let's dive into that a bit. Why do you think it's the worst doing a liner treatment for athletes?
Because of the inflammation of the gums, it's like, or the periodontal, I don't know,
Ligament.
Yeah.
ligament.
Yeah.
It's like week after week. It's too much for me. But after that, all the alignment companies told you that the occlusion is checked in all the positions, but that thing they check is plastic and plastic. They don't, not this kind of aligners. They check the occlusion without them, but the patient are not without the aligners. So it's something that is not studied, is not checked. And in addition, for me, all the patients, or most of the patients with aligners start doing different parafunctional things. Don't you think that?
Mm-hmm. Yeah.
They start moving their jaws, and I don't like. And the truth is that in my office, we offer this kind of treatment to finish orthopedics treatment with proper aesthetic, but for sport people, it's not my first choice. Never.
In sports dentistry, it's not just about treating injuries. It's about optimizing oral health for peak performance.
That's right. Because when athletes push their limits, every detail matters, even their oral health.
That's why the Sports Dentistry podcast is being powered by Philips, true innovators in oral health technology.
Philips Sonicare toothbrushes use advanced sonic technology to disrupt plaque biofilm, removing up to 20 times more plaque than a manual brush.
And that's critical for athletes. With high carb diets, dry mouth, and frequent energy supplements, there are greater risk of caries and gum disease.
Philips backs evidence-based dentistry, giving us tools that fit perfectly into performance-driven treatment plans.
So whether you're helping your athletes recover, protect, or perform,
elevate your protocol with Philips.
Yeah, that could be a challenge because we see the likes of Invisalign and Align, and they're linking in well with like the NFL. They're big sponsors of American football. You see them in the Super Bowl. They have like the sponsor the prize nights, and they're getting involved. And I was just watching Will Ferrell's new episodes on Netflix, and he's wearing an Invisalign. It's got the stage where it's almost like Invisalign, and obviously because they're the most marketed brand, but now clear aligners seem to be everybody's first choice as an adult. And then if you've got athletes, particularly athletes that are maybe doing lots of PR, whether that's on their social media or they're doing interviews, they don't particularly want to wear braces unless they're Lamal. Lamal seems to not want to take his off, but apart from him, everybody else seems to want the liners.
Yes, but I think that they should think that maybe it's not the time for them between they are professional players or professional sports people. Maybe it's too much for them. It's like, why are you putting that difficulties to your body? Because it's a difficulty. It's a. You are not adding. You are lessing. I don't know if.
But I don't think they see it like that. I think that's where we maybe have to try to educate, because their motivation is that they want to have a nice smile when they see themselves in photos, when they see themselves in interviews, when they're watching videos, and they think that's their motivation. So they probably don't see it as something that might actually have an impact, a negative impact on their body.
Yes, I understand that. That's the thing that people nowadays, they still think that tooth are only aesthetic thing. And if you think like that, okay, put aligners and it doesn't matter. But if we are a sport dentist, it's our duty to say them that this treatment could change your body's alignment. and it's going to put differences in your body. And it's like, I know that you spoke with Flavia also about plastic things. Alignments are plastic stuff.
Yeah.
And there are beautiful studies in the University of Valencia about the materials and about endocrinology disruption. And the worst are these kind of aligners. It's not the same to put a Schwarz or this kind of acrylic that is already done, or bond some braces, or new plastic week per week. It's awful for our body.
So
and there are like some windows, different windows, I mean like a pregnancy, imagine, or where different windows in your body or in your life that there are like more or less dangerous.
Like just when you were talking about and the plastics now, when a lot of our patients, when they finish orthodontics, whether that is with fixed braces, with brackets, or with aligners, then we're giving them plastic retainers. Is that the same concerns, or is it because that the aligners are being changed every week makes them more of a concern?
Nowadays we do that. We offer these aligners. They are like harder aligners to retain. But 20 years ago, we offer another kind of devices, like Schwarz. I think that they are
the Holly
much
retainer.
better. Yeah. Yes. This kind of Holly is not so painful or harmful for us.
Okay.
In terms of disruption, and it is so unbalancing for the occlusion.
It is an interesting topic, and I suppose that's the whole point of having this conversation is there's different schools of thoughts, because you're saying that it's not your first port of call, or it's not the first treatment that you would offer. It is a treatment, but it's maybe not the first thing that you would offer. So the athletes that are coming to see you, what is there a main sport they're coming from, or is it a wide variety of sport? How do you see the presentations from different sports? Like if somebody comes to you from soccer or from hockey or from other sports, have you automatically got in your head what potentially could be the problem, or is it just a wide variety?
I'm not sure if I got the question, but of course that it depends of the different kind of sport they practice. My view is going to be different because I'm going to offer some mudguard, of course. And if you are in this kind of, for my son, for example, I was talking to John that he practices ice hockey. He's only 14 nowadays. And they use like a big helmet with a big chest, or I don't know.
Visor.
But when they are, yes, visor. When they are growing, they have like the middle one. And I prefer doing all the changes in the mouth, orthodontics, early. If it's possible, and that's why I see too many children, because all the work you do when they are young, it's a work that you don't need to do when they are adults. And I know that some patients come when they are adults and you have to do different treatments to move their teeth. But I sometimes also choose this removable.
Yeah, removable. Yeah.
Removable.
Yeah, removable. Yeah. Perfect. Yeah. So how early is ideal to treat a child?
With children?
Yes, with children. Yeah. When
sometimes the treatment is only giving advices. Imagine that if you feel that theory that you need hard work, I see not newborn, but less than a year, I start seeing children really early.
Less than a year?
Less than a year, yeah. Because sometimes they have a tongue tie.
Yeah.
They have also like a crush bite because they have different allergies. So
Yeah. And
I
then,
know
so,
that in my office, the cases are a little bit like high difficulty cases. It's not the general people that comes to my clinic, but I start seeing them really early.
and then what are the types of things are you advising at that stage? Are you checking for tongue tie? Or are you looking for if they're breathing through their nose, their tongue, how their tongue is functioning, their diet? Is that the sort of advice that you're giving to the parents, obviously?
Yes and not. Nutrition is one of my favorite issues also, but I'm not a nutritionist. But I know the meaning, the high importance of some kind of changes in our diet can do a variation in our mucosa. And mouth breathing can also finish in a dysbiosis. Dysbiosis is said in microbiome. You have a disbalance of the microbiome.
It changes the microbiome. Yeah, it changes the bacteria.
Yes, mouth breathing. When you are a mouth breather, you also have a change in your oral microbiome.
Yeah.
So I love this part of integrative view. And in our office, we have, as we were telling, physiotherapists, also breast feeding instructors, optometrists, not nutritionists, but I collaborate with a lot with them.
Yeah, so actually, you've laid quite nicely into that. So you were saying earlier before we went live that you have your own clinic, but it's more like almost like a mini medical center. Can you give us some insight into your thinking process when you were setting that clinic up? Did it start just as you doing dentistry and then you added these things, different other aspects in, or did you plan to have this all in one clinic and set that clinic up? Give us a little bit of insight into your thinking when you were setting your clinic up.
When I started 25 years ago, when I started working, I worked in another office for another dentist. And after that, and after I became a mother and with 2 children, is difficult to share your life and the motherhood and all of this kind of things. I start working in my own office, and it was a rented box, nothing more.
No windows. Did you have a window?
No windows. It was a little one over there.
Yeah.
It was like hell. Yeah. But, and it was something that I thought for myself, I'm going to do only this kind of functional thing. And I have my agenda schedule empty, nobody, and people phoning, and I have a cavity, and no, I don't do this kind of things, and nobody in my agenda, but I was already like in this way.
Yeah.
And little by little, I started being more known between physiotherapist world and a little bit in an integrative world. And I needed to move to a bigger place. And in that big place, I started working with optometrists, podometrists, physiotherapists, because some children, they need glasses, they need, how do you say, the things you put in your
Insoles.
feet? Insoles. Insoles, yes. Yeah. I thought that insoles was in French, but no, it's in English. Insoles, glasses, braces, everything. And they have scoliosis and if you are a parent with a child of that this kind of child, it's like, okay, come to my clinic. We are all together, and we are going to back you, return you
that's it.
a proper child.
So
Yeah, that's it.
all I'm imagining is Forrest Gump running down with the leg braces, and he goes into your clinic and all the leg braces come off.
No, but sometimes you need you do need all this stuff, but the order, it means a lot.
Yeah.
You need to know which is the more painful part of this little body, and start with that, and a lot of myofascial changes are going to happen, and you need to follow this order.
I've always thought a polyclinic and having multidisciplinary people in it who have different specialties makes so much sense. That you can go to one clinic and you can see podiatrist, physiotherapist, dentist, and it's not something that I've seen in the UK at all. There might be a clinic out there, but it's not somewhere that I have seen. And I thought about it for a period of time that maybe it's something that could be relevant. Is that quite common in Spain to have clinics like that where they have multiple different specialties?
No, it's not common. It's more common to have a lot of specialties, but each one in his own. Here, the common line is the.
So just on that then, so you're in the clinic and when a new patient comes to the clinic, do they go to a specific person, or is there like a treatment coordinator at the start and they do an assessment and then they say, well, you need to go to Eider to get checked for your orthodontics, you need to go here. Describe how that new patient journey is in the clinic.
Yeah. Some of them started with optometrists or physiotherapists, but the main group of our patients are people who is looking for a dentist, but a different dentist, because we are more dentists than any of the other careers. And it depends of the person. It's not an IA, it's a person who is on the phone asking different questions. Have you got a pain? Where is your pain? And it depends of the answers she can put with one or another specialist. Sometimes our agenda is, if my agenda is full and the physiotherapist have a gap and the person is calling has a pain, it can start with the physiotherapist, and the physiotherapist call me, Eider, please come and take a look. But usually is more order.
Okay.
It starts maybe with me. I do the clinic history. I love doing questions, because I sometimes say that I speak more than I work. Because that's the real thing. If you ask proper things, you are going to have a lot of ideas and items that it matters. And after that, maybe I start with another patient, and this patient is seen by the physiotherapist, and she makes some postural tests. And she told me, Eider, you need to start because the mouth is the main painful part. Or he needs to start with insoles or with visual therapy.
Okay, it's interesting.
Usually in our office, this kind of tests are which decides who started the treatment.
Okay, so the initial test will then decide what way the treatment will go, where you start with the treatment and the follow-up treatment.
Yes. Or imagine there is a child who is 13 and he has a crossbite, and I need to work with him, but he is not suffering for airway issues. He's sleeping properly, but he cannot run, and he's starting to be like apart from his friends because insults. Or sometimes it's live and sometimes there are the tests that are deciding. So that's the importance of doing the proper questions, a lot of questions.
We are delighted to have Ionate as a sponsor for the Sports Dentistry podcast. Are you looking for a water bottle that's built to keep up with your active lifestyle? Look no further than Ionate, the totally leak-proof water bottles with triple lock technology to prevent spills no matter where you're headed. With a simple one-touch opening mechanism, you can sip on the go without hassle. Plus, Ionate's sleek modern designs are not only functional but can be personalised just for you. Made from high-quality steel, these bottles are easy to clean and best of all, they're sustainable. From 320ml to 1200ml, Ionate has the perfect size for you, whether you're just out for a jog or going on a long hike. And it doesn't stop at water bottles. Ionate also has travel mugs and flasks to keep your drinks just right wherever you are. Ionate have officially licensed water bottles for the NBA, NFL, MotoGP and British and Irish Lions, so you know you're getting the best. I have been using the bottles for a long time now and cannot recommend them highly enough. So head over to www.ionate.co.uk to get your hands on the best bottles in the business, bar none. Now back to the pod.
And know about the life of our patients.
Yeah,
I think that's the thing, because everybody wants answers quickly. They want a quick answer. You put it into AI. Yeah, quick fix. You put it into AI and you get an answer back, because everybody wants something done quickly.
Yeah.
But like you're saying, you're spending the time listening to them and chatting to them and getting a really good understanding, and that's where you're getting your diagnoses from, and then that's how you can then kind of delegate with your other professionals. You say, actually, this is more towards podiatry, or this is more towards physiotherapy or chiropodist. So with your role as the Spanish sports dentistry, is that something that you're trying to implement to the people who are a part of that association, in terms of trying to get them to be part of a polyclinic, or are you quite happy for them to kind of do what they're doing in their roles that they have?
Yes and not, because when I saw that there was a link between the mouth and the body, and I started offering, I create a training of a sport dentistry, because I saw that thing that I was doing was an improvement for that people. So I create a training course and I started offering with all the themes that I thought that they were interesting. Nutrition, myofascial change, breathing, a lot of things that they are not super linked to the mouth. But of course, they are also trauma, real things also. And for example, Maria, John knows Maria, Pablo, we have like now we have a university expert of sport dentistry. We have like 6 editions already. Some of them have some kind of offices similar to mine, but another ones have their general dentistry practice, but they do also sport dentistry.
Yeah,
sport dentistry in more common sense of the word.
Yeah, that's good. Well, so give us a little bit of a background to the Spanish Sports Dentistry Association. When did it start? And what does that look like?
As I have no very good tradition of traumatic, I met Maria, that she is expert on traumatology. And we both create the Spanish Association of Sport Dentistry. I think that it was 2022, more or less. But it was something, because when we wanted to know more about that and we Googled it, nothing was there in Spain. So we created in order to do an association, do something, create a family, and be stronger. And Maria, that moves a lot, she knew Thanos, Stavros, Tillman, and we went to London in the isokinetic, FIFA isokinetic, for the first time. And after that, we went into the European Association and we started to share all these congresses and learning from all of you and trying to help with our different kind of knowledge or different point of views. That's our.
So you've been able to build a community, a sports dentistry community in Spain. I know we have the UK Sports Dentistry Association third annual conference. We launched that shortly after when we met in Murrayfield. We felt we needed to have an association in the UK, and we have run one-day events, but we actually haven't got our membership up and running because it's when you're doing everything outside of your normal work, it's hard to get on top of everything. In Spain, do you do one-day events? Do you do events, or is it still very much a community? You have your own course. Is that part of the association, or what are the types of things that the association offers?
Yeah, we need to put more focus and more order to the structure of the association. We are still in that phase. The training course is done. Is something that is with the university and it's already done. The association, usually the members of the associations are people who has finished already that training. But our goal is to be free, or if you are interested in sport dentistry, that you can join to our association and do conferences and things, but we all are with a lot of things on our plate, and it's difficult, really difficult. Yeah. But we know that we should do.
So the course that you spoke about, you run that through the university, is it?
Mm-hmm.
You run your course. What university is that? Is that the university in Bilbao?
It's a new one, relatively new. It's a private one, the European University of Vitoria. It's called EUNAIS.
Okay. Yeah. And how long is the course? Is it like a 1 week course, or what? How long is the course? Is it a 1 day course, 2 day course, 1 week course?
There are 4 months.
Okay.
It's 4 months online course each week. We have online streaming classes, but they have like a platform with a lot of themes.
Okay.
And after that, we have a practical weekend all together to practice all the things that we have learned.
That's what I was going to ask, because me and Umar might be tempted to come if there's we're going to the sun, Umar, is that?
Yes. Yes. Anything for a bit of CPD in the sunshine in the Basque Country. So
no, it's not a sunshine place here.
Well, it is at the moment. No. You're saying
it's the north. It's the north. For you, it's the south, but it's our north.
Oh, I see. Well, there's definitely more sunshine there still compared to here. Yeah. So I'm sure you still get a bit more.
It's always going to be warmer than Edinburgh, because everywhere is warmer than Edinburgh. So
we are aware that if sometime we need to hold any congress, it should be in a Mediterranean place, or Malaga, or somewhere that European people likes.
Yes. I can get done with Malaga.
Yeah. Malaga, Alicante.
Rumour's very fond of Benidorm.
No. No, my brother-in-law lives in Sant Cugat, just outside Barcelona. Beautiful place, little village, and we've been down there to visit him. It's a stunning place. Barcelona obviously is lovely as well. So, but anywhere where the sun shines is I can get there. Don't worry.
So what's the future? What do you see the future for you in sports dentistry? How do you see it developing? You've made me now start to think about how many athletes have I got currently in aligners. do I need to check in on them? We could maybe run a research to see injury rate with athletes that are in aligners compared to athletes that are not in aligners.
Yeah,
that would be an interesting study.
I think that we have like although we are a little bit disordered people, not disorder, but we have a lot of stuff, all of us, but we have like a good mixture between Maria, Pablo, and me, that there are like directors of the training right now, because Maria is super expert of trauma. I have this functional airway and growth part, and Pablo, that his brother is also a trauma doctor. They know the work of the other so good, as they have done a lot of research and with this functional point of view, but they are making research together, doctor, dentist. They are working a lot with real sports people, and we are like linking a lot of things together. And I think that we are going to do beautiful things in Spain. We need structure, but we are going to do it.
Yeah, no, it sounds good. You all seem to be able to complement each other, which is good as well.
Yes, sometimes in other places they have started with the association and the university has come later, and we started on the other way. We started with the training and the association is going after that.
Yeah, we're a little bit like that in the UK, because we had the sports dentistry courses in UCL from the early 2000s, and it's only the last 3 years that we have done an association. So it is a little bit like that where we are. It's just difficult when you're doing an association and everybody's giving up their time for free, and they're trying to do it outside their normal working hours, and everybody's busy with life and work and everything else. It's difficult to get it all to come together, and that's where just sort of the passion has to try to keep taking over, and everybody sort of supports each other and helps each other out to try to get there.
Yes. When we came back from Italy, from Naples, the last conference, it's like, we need to go, we need to do with other.
Then two weeks later, it's like back to work.
Yes, but to work, a lot of deadlines to follow and life.
But that's it. When you go to different conferences and you meet people who are very similar to you and they've got the same drive and the same passion, you do walk away feeling energized and you feel like you want to carry on. And I think that's the point where you have to always remember that's the reason why you're doing it and why there's other people who want to do it with you. And we've had this as well, where people are very keen and they want to get involved, and then a few months down the line they realize that actually they don't have the time to commit and they don't have the capacity to give the time that's needed, which is fine. I'd rather somebody has a go and tries to get involved and tries to do it than just not do it at all to see if it's right for you, because in amongst all that you'll find some gems and you'll find some really good people who you want to work with and carry it forward. And I think, obviously I wasn't in Naples, but I obviously heard good things about it, and with what you guys are doing in Spain and what our colleagues are doing and all over Europe, really. I can't even name one single country because everybody's doing amazing stuff, and all roads will lead to Lisbon next year. I think that's kind of where we're at now, with it being the EU4SD, and I can't believe it's been about 8-9 months since Dusseldorf, and it doesn't actually just seems like it was a month or so ago, and then we've got our third UK one on Friday. So will you be holding conferences soon in Spain? Is it something that you're planning on doing? Is there something that we can look forward to, or is it still in the very much the planning phases at the minute for the association there and having like a congress or a conference?
Yes, we should do a congress. This year is going to be impossible because we are in July and nothing is prepared.
Yeah.
But yes, next year for sure we need to do something for us, for Spanish people, to start practicing for the day. Maybe in the future we need to hold a European Congress, who knows?
Yes.
So need to be prepared for that, even for not for fun, but for maintain to keep this community, this feeling, research, this kind of things, passion that everybody has.
Yeah, I think the community is the big thing, because I think that's what one of the things I'm really looking forward to on Friday is seeing people that I mightn't have seen since Manchester, which was our last in-person event last year. So, like, obviously, myself and Umar see each other a little bit more regularly, but there's lots of people in our community that we only see once a year, and the year just goes so quickly now. So I think it's important to try to even have some sort of event in person, because it, as Umar says, it energizes you. It brings that focus back, and it keeps the energy alive.
Yeah, I almost forgot, but Jaime, you also know Jaime. Yeah.
Or Jamie,
Jaime
or
is,
and as we would pronounce it, Jamie.
Jamie, yes, Jamie.
Jimmy is a super worker, and he was trying, and I think that he is going to achieve that link. The CEPES is the Protection Society of Spain. They usually make like a winter session in Baqueira, that is a skiing center in Spain, a very beautiful place. And this year, hopefully, we are going to offer a sport dentistry special course for them. Thanks to Jamie.
Jaime. Yeah.
And yes, little by little, we are doing different things, and talking with different dentists, and they should know that sport people is a little bit different.
Yeah. I think that's just it. We just got to keep pushing and keeping raising the awareness and educating, and we'll hopefully get there.
Slowly but surely, we'll get there. We'll get there. But then it's why we've got people like yourself coming on and talking about your role as a sports dentist, because it's very different from my role as what I do with sports dentistry, and it's very different to what John does as well. So
he's ruining all his athletes with cheap aligners, cheap aligner treatments. He's ruining all his athletes.
They might be injured, but they've got a great smile. Yeah, but I think but that's the important thing, is that's about having these conversations, these open conversations where people do things differently, and there's no right or wrong. It's just kind of, it's something for us to then think about the athlete who's coming in. What stage are they in their career? Is it something that they should be doing? Is it a possibility that we could cause more harm than good, rather than just aesthetically wanting to get them to look better? Is it something that maybe they need to think about that? It's definitely food for thought, and it's been a really good conversation, and it's been really nice to hear something different, I think, compared to some of the other guests that we had in terms of their roles as sports dentistry, because we talk about aesthetics, we talk about trauma, we talk about other things, but with your role in terms of functional and airway, and airway is something that me and John have talked about quite a lot, because it's something that you see now with collapsed arches and collapsed maxillas and cross bites and stuff like that. It's really, definitely, it's more prevalent, 100% more prevalent now, I think. And that's where you get in, that's where you come in, and I send them to you and you sort it out and then send them back. That's what we do.
Or we might have to go over to Bilbao just to make sure they can find Eider's practice, you know?
Yes. We'll need to do that. Yeah. We have to go and do a recce and check it out, make sure. Yeah.
Thanks very much for your time, Eider. It was great having you on. I know we've kept you up quite late tonight, so thanks very much for giving up the time and coming on. And as Umar said, a really enjoyable chat, and it's given us lots of food for thought. And I'm sure a lot of our listeners will be the same. Yeah,
thank you very much.
Thank you.
Thank you.
Thank you for inviting me. It's a pleasure and honor to be with you, John and Umair.
Yeah, no, thank you.
Thank you.
See you. Bye.